everyone, hello, this is Irene with SaugaTalks here today. I'm having enormously great morning here in Connecticut. It is cloudy, it is cold, it's December, everything expected. And today we will be talking about digital health. We'll talk about wearables, we'll talk about cool technology, and who is the best person to discuss it with, if not João Bocas, who is a digital health world recognized influencer and leader. He is digital transformation consultant. He is keynote speaker. So he is the right person to talk about digital health too. Hello, João, how are you?
Hi, Irene. Nice to be here. I'm delighted to be here. Thanks for the invite.
Absolutely, absolutely. Because, you know, I do speak with influencers, with speakers. I speak with speakers and they speak back to me here, but mostly if they're all fascinating people in tech. So those who are new to this channel, those who are watching on Twitter or maybe LinkedIn, subscribe, follow. They're fabulous, fascinating people here every week, and I post daily if you haven't noticed yet. So absolutely, João, I'm butchering your name. How do I say it right?
João Bocas.
João Bocas, absolutely beautiful, fantastic. So we're here in December of 2020, and 2020 was about health. And 2020 accelerated digital transformation in many industries. Healthcare is one of them. So can you please talk to us about what did we see on this landscape in 2020 before we get into trends of the future?
Well, it's been certainly a very interesting and challenging year in all aspects. I mean, I could talk about the business side of things, society at large, and of course, as you mentioned, health has been kind of really transformed. We have the global pandemic. But before I kind of go to that, because we're talking about digital health and health in a context of industry, but also not just healthcare industry, but also society, I think what we've been seeing lately is, and I'm a great believer that what's happening later is it really highlighted what we should be doing in terms of digital transformation. For example, in digital health, there's been a big push in the last 4 or 5 years with regards to electronic medical records, to telemedicine, to emerging technologies addressing global issues. But now we really see that the systems, they were not actually prepared. Most of the governments, most of the organizations, they were not prepared for a big challenge, you know. So I think what happened, it really highlighted where the gaps are, the needs are, and what we could be doing and improve. And now we're seeing a big push about transformation going really fast, which is probably one of the benefits around the pandemic. Is not just negative connotation, is a benefit in terms of we all kind of have a wake-up call that we need to do things faster. So
in healthcare, we did start talking about telemedicine. We're talking about wearables in different way. We're talking about absolutely, you know, different way as a consumer, but I'm sure providers, doctors who had to accelerate their digital move fast. So can you tell about this, all these different groups, how we all affected and what we will see in 2021?
Yeah, sure. I think the telemedicine and the video consultation, for example, virtual consultations have been moving really, really well. But now it became a point where, unfortunately, the last 6 months is probably the only option because we can't go to hospitals, we can't go to the local doctor, we can't go and visit the clinician. So I think these technologies were already there, but I think going forward, nothing is limited to one direction, I believe, and I believe in doing things in many different ways. But what I've seen lately is that telemedicine is a reality to really go forward. In 2021, you'll be probably the only way to kind of push healthcare forward in terms of visiting doctors and hospitals, because they're overwhelmed with COVID, they're overwhelmed with the long-term conditions of other patients. We don't want the average patient to kind of put more strain in the system. So if I have a normal condition, a cough or a flu, if I can visit a doctor online, is usually beneficial. I mean, from my doctor that can see me from the comfort of his home, I can have a doctor consultation from the comfort of my home, but also we're not putting strains in the system in terms of adding more risk and also adding more strain in terms of resources. So it's a really win-win for everybody.
Absolutely, and you're touching like good topic when consumers, us patient, us population, driving these new digital practices. So wearables, we do want to monitor much, right? We do want to know everything. Some people more comfortable, right, going in all the way, you know, tracking every moment of their life and trying to understand every number they get back. So where is this cool innovation? So can we talk about the technology promise first?
Yeah, sure. I think the wearables have been, well, I see like we're in a different generation now because we started, I'm from the times where 20 years ago, 15 years ago, we had the pedometers. I don't know if you remember them. And it was only like a very, a digital, you see the numbers of your steps. And it was like a big thing. I mean, I remember the corporate wellness days, the companies are buying pedometers for employees. Wearables have become a long way in terms of their development. And now I think it's becoming a bit less relevant, just the number of steps. They can do so much more, you know, with sports performance, with sleep tracking, even monitoring and also managing of long-term conditions. And now wearables are actually permeating many industries. Of course, health and healthcare are the main industries because they give us from the human body, human insights, human data, health data in this case. But now they're permeating many industries from fintech to construction, you know. So it's very interesting what's happening in the wearables world. We don't want to become too obsessed about what you mentioned about tracking every single move, because that can have a negative connotation. For example, for people trying to achieve weight loss, we all know that weight loss doesn't happen overnight. It's a consistent effort of eating healthier and exercise, more physical activity. If you have a wearable and expecting a miracle in a week, you might be very disappointed because it takes time to modify a behavior, and people sometimes might have a lot of expectation on wearable, and the wearable is not the miracle source. The miracle source is always the driver behind the wearable, which is the human being. But I strongly believe that technology in combination with the human being, we can really do wonders and make really great things happen.
Absolutely. So taking it down, technology conversation. So all the data, like you said, right? Personal health data, every kind of move, every kind of data collected, right? There are a bunch of devices, bunch of apps on our phones to track the data, to track health data. So our phones becoming our wearable devices in many cases. All right, with all the bracelet and rings now. Okay, the sleep tracking rings are big. Here in the US, people playing all kinds of games with tracking every possible pattern. Did I sleep well today? Do I need to improve next night? So this is very, very fun game. If you take it like you said, right? If you don't take every digit literally, because it's everything, yeah, it's about changing your life, right? More than looking at the devices, but at the same time, right? Technology. So what do you think the new breakthroughs there that we're about to experience in 2021?
If you look at some trends for 2021, if we talk about wearables, for example, if you go back to the wearables, we see a big trend that is actually like FashionTech. You know, we want wearables to be sexy and more attractive. You remember the big bracelets that were not very attractive in one color. If you see the big innovators in wearables now, if you see, for example, Fitbit, probably the best well-known brand, they're innovating fast. The watches look really good. They have different colors, they have different, I mean, the times, everything is evolving. So one big trend that I really like personally is fashion tech. You can have a wearable, it is a piece of jewelry, it is a great watch, and it looks good. You want to use it, you know, so.
I have one, I have Fitbit, and I already to my third bracelet or something, okay, like you said, changing color. And you know what, I think in pandemic, people experienced more desire of acquiring such toys because first of all, you think you're doing something good for yourself, but most importantly, something that is useful in this environment where we're not going to concerts anymore, where theaters are not there when we need them. So the investing in this kind of leisure tech and sort of, you know, fitness tech and fitness equipment and getting better than what we are. I think that was a trend in this year. What do you think?
Sure. Yeah, it was certainly a trend. And with the global pandemic just highlighted how vulnerable we are as human beings to, I mean, to unhealthy behaviors. For example, I'm working from home like everybody else. I consider myself really healthy. I work out in the morning, but sometimes I can forget to go out for a walk and get some fresh air and stay at home for 2 or 3 days. And I think now we became more aware of the things that we should be doing, walk more, have a better connection with the human being, rely on our gadgets to give us some indication if we're sleeping better, if we are active. So I think wearables there can be an extremely valuable partner if we use it in the right way. And it's always down to individual and personalization. And I'll give you an example. I'm very interested in my sleep. I'm not as interested in my steps because I'm very physically active and I work out and, you know, different goals for different people. So some people want to become more active. Some people want to look after their diet. Some people want to sleep better. So I'm very cautious of my sleep. I try to, you know, but it's always about improving. Nothing is stepping stone. I might get 7-8 hours one day and then next night I might not sleep as well. So the wearables are an excellent vehicle there to kind of keep you on track, but also to give you the insights that you need. But you need to connect intrinsically something that is meaningful to you, because we use wearables and want wearables for different purposes, you know.
Absolutely. You're about to say, yes, some people want to be more active. And I was about to add that some people want to be less active. How about if your app telling you, hey, you are doing too much. You're moving too fast. You're, spending these calories. You have to sit down, slow down, eat more. I'm kidding here, I guess. we're all kind of, we need more movement more than less, but yeah, thank you for that. So on business side, right, on technology, there's so many fantastic startups here. We're learning almost every day, you know, following health tech news, how new companies popping up here and there and offering next better, you know, more convenient solution for all of us. From business standpoint, do you see that product life cycle development in the industry is accelerating as well? Because it's such a huge promise, it's such a huge opportunity.
Certainly, I see, especially the last 2-3 years, a lot of wearable companies coming out in different segments. I mean, fitness, wellness, them healthcare, medical related. So I see a lot of companies appearing now in healthcare space. So which is really great, but sometimes it's also a bit concerning because I don't want to play devil's advocate in here, but now the big players have a big interest in health. The Apple, Google, Microsoft, you know, and I think it will not be space for everybody. Even Amazon now come out with a new wearable bracelet, the Hello, that tracks the behavior as well as the insights. What I'm trying to say is great that a lot of innovation is coming to the marketplace, but I'm not sure if you will be, the marketplace is really big, but I'm not sure if you will be room for everybody. That's my only concern. we know that not all companies succeed, and they say not just in wellness and wearables, but they say that 1/5 of the businesses that don't succeed at all. So I think it's a natural thing, but I'm concerned about actually too many companies are coming out. You know, some of them they doing exactly the same thing. You know, and everybody thinks I'm gonna go to a big player, get acquired, or go to an insurance company. But if you, for example, and I've done some consultancy with insurance companies and health insurance companies, which is they're very conservative the way they think. They're risk averse because they're insurance companies by nature. And if perhaps you are a wearable company or an innovator, it's in one segment, it's only one company doing business with that insurance company. And I've been involved in startups in the past, and everybody has an ambition. I'm going to go to an insurance company and sell millions of apps or devices or licenses. And the reality is not that, because only one provider will fulfill that insurance company. So it's a bit concerning. I'm not trying to be negative because I support innovation and I like seeing companies coming out and try to be successful, but I think we're seeing a bit too much coming out.
There's no such thing as too much. You see, let all the flowers blossom. So absolutely. I do hope consumer will win, right? Because the best supposed to win that race, but the reality of the industry, right? And knowing that you have to have more than excellent product to succeed. You have to have a good momentum. And maybe again, 2021 in the marketplace will position many of these companies, right? But you have to kind of sense 360 degrees what's happening in the world to be successful, don't you think? Yeah,
sure. Well, you mentioned a couple of things there, like the culture, the mindset. You know, if we talk about innovation in general, not just in healthcare, there are always many elements that are very important. The people, the mindset, the culture, the education. Are we willing to take risks? You know, if we don't take risks, we don't innovate. If we don't try things, if you don't try a wearable, I don't know if I like it or not. If I don't fail, I don't know if I sleep less or more. So it's always about the kind of reinventing and revolving, isn't it? That's my opinion.
Yep, iterating, right? Trying, failing, right? Iterating, getting better with each iteration, that entrepreneurship over there, right? So what are you working on these days, João? I mean, I know you are up to something completely new and innovative in your life.
Yes. I mean, I'm always kind of busy doing things for other people. As you know, I'm doing quite a lot of influencer marketing. I'm working with a couple of brands on social media networks. I'm very active on Twitter and LinkedIn primarily. The other platforms I don't use as much. But I'm doing some consultancy for some clients. I'm doing some influencer marketing work, small projects, 1 or 2 big projects, and I'm working on my YouTube channel, which we talked about before. So I've been thinking for quite some time about, I want to do good for the world. I want to do well business-wise. I mean, I'm ambitious. I've been in business for a long time. I want to kind of do well. But I've been thinking 2 things. One, how can I leverage my network, which I have a big network. I've built the last 8 years a truly global network. With people in healthcare, I have a lot of connections, from innovators to public health leaders to entrepreneurs to CEOs in big companies, small companies. So I've been thinking, how can I leverage my network, but also how can I do something completely unique in healthcare? Because it's a big gap to talk about the things that we're talking about now, the challenges, the issues, the consumer, the technology. So I'm launching, as you know, my healthcare technology YouTube channel, Digital Health and Wearable series, focus on healthcare technology, but we'll talk about other things, all healthcare related, emerging technologies, challenges with innovators, I mean, technology, digital transformation, AI, 5G, all these things affect healthcare, what we need to do, the big challenges. I'm interested in really stirring the conversation in different ways with many experts, because I'm not an expert in everything. For example, I want to have CIOs there that have like these deep challenges in terms of integration of data, systems, technology. I want to learn, but I want to bring that knowledge to the world, you know, so broadcast as a think tank, a thought-provoking, thought leadership think tank that we can all learn from each other. So that's my biggest project for 2021. As you know, is launching in January 2021 with a big top health tech innovator and top tech health tech influencer like me. So I'm excited, very excited about that.
Absolutely. Absolutely. Congratulations. It's not easy to come up with some new endeavor over there. So I've started, what is it, January this year, you know, and feeling good and going strong. So happy to promote, happy to help where I am, because the newest trend actually 2020, and I'm sure it will continue next year, collaboration among creators, collaboration among colleagues and professionals across the globe. Of course, we have all this great technology to help us now. But most importantly, we are in the same space. We are here to spread the wisdom and knowledge, okay, from those who are more knowledgeable than we are. And yes, collaboration is the key, because I'm learning every day. I've met so many wonderful people this year just because, you know, of doing what I'm doing. So best of luck with new endeavor. I'm sure it's going to be great. And yes, absolutely, your network will help you, will leverage, you know, what you have to say, and they will lift you up, right? They will bring you, yeah, that moment that you need, right? Starting new media almost. So that's fantastic. So you did talk about emerging technologies. Can you tell me which one excites you more? Because I'm a lot about AI these days, okay?
Yeah.
AI, 5G, Edge, GPT-3, the new algorithms, the new ways to read that data we talked about earlier. So what excites you?
Well, in terms of, I've done a big study on health wearables engagement, like 159 pages about wearables. But I wrote a book chapter for a publication with other thought leaders around artificial intelligence and wearables. And my vision is that artificial intelligence combining with wearables will be the true game changer. Why? Because before, a few years ago, we didn't have enough data and enough expertise to utilize artificial intelligence to its full potential. But now we have tons of data, gig and gigabytes, and we have the wearables and we have the vehicle to capture the data. Now it's probably like the other way around. We have too much data, but certainly AI. But also, I'm very conscious about 2 or 3 things that are very exciting. And if we talk about RPA, for example, to robotic process automation, that robots and bots will do some of the work around the data, whether that is around customer service, whether they are repetitive tasks, whether they are reports that just can produce themselves without human interaction. In healthcare is a big thing, but also edge to cloud. Because one of the things that, and I'm not an expert in cybersecurity whatsoever, but if we look at healthcare, cybersecurity in healthcare is probably one of the most danger and impacted industries in terms of attacks with cybersecurity. Why? Because we have many different points of entry. You know, is the wearables, is the connectivity, is the hospital, is the doctor, is the nurse, is many people logging in and going to the different systems and medical devices and things more often. So for example, if you are in a different industry that doesn't require to go on a system as often, the level of risk is less. It's like driving a car. I mean, I don't want to talk about accidents, but if you drive 100,000 miles a year, if you drive every day 1,000 miles, you're more prone to have an accident that you just drive once in 2 weeks or once a month. it's a little bit like that, because in healthcare, these things are exposed, you know, and people go there often. You see the cyber, the attackers now, they find, the other day, I was at a conference last year, at the beginning, actually, 2020, the times when we have conferences, right?
Yes, good old times.
And this cybersecurity expert gave me an example. He just blew the audience away. He said, you know, we're talking about IoT and cybersecurity. He said, you don't imagine where the attackers found a gap to enter the system. It was in a fish tank that had an IoT device. So anything can happen, but healthcare are highly exposed to cyber attacks.
Seriously, that's a point. Yep, that's a point to remember. So again, the big promise of AI, right? And now on 5G and 6G we're talking about, okay? I'm amazed of what will be possible. And again, healthcare may not be the first industry to jump into that kind of innovation, but we will see what do we see there next year.
Yeah, you see 5G is very interesting because look, if we're talking about wearables, they will make the wearables more connected, more intelligent, more data in a faster way on demand, but also is affecting the interactions in hospitals, accessing data faster, anywhere, anytime. I was giving an example a few months ago, which is very, very good. If we have, for example, 5G, you can even get the data at the ambulance. When you have a patient with an emergency, like an accident or something really big, drastic happen, you can have access to the data even before you get to the hospital. So you can start planning ahead what needs to be done, what is the blood pressure of that person, if they have any health conditions you need to be aware of, are they allergic to any medicines? So you can get to the hospital, you're ready to treat instead of trying to find information and things that will delay an intervention. So that is interesting. But I mentioned edge to cloud computing, and if we talk about medical devices and data, especially data now can be storage and also access at the edge at certain point. That's really, really interesting, you know.
Oh, absolutely, absolutely. And of course, I mean, again, in the United States, healthcare is a huge and very fractured industry. I'm sure you're familiar, okay? So certain barriers for data, what open standards and open, there are huge number of discussion in the industry. I'm not an expert, but all I know that getting all the data points about this patient, about the medications, you know, habits, every factor that actually affects the present condition, that will be very interesting to see how that will affect. But also I do need humans to make decisions when I do need those decisions. So for me, I'm not relying on robots just yet. What about you?
Well, we'll need to see what happens, but the robotics are actually doing great work in different ways. For example, in terms of surgeries, and they're assisting us, they're assisting surgeons.
I was about to say augmenting, right?
Augmenting, yeah.
Oh, yeah. Fantastic.
Okay.
Wonderful. So yes, time is flying. We did talk about technology. We did talk about us consumers and doctors and industry in general. So thank you. Thank you so very much. Best of luck in 2021. Let's stay healthy and let's find new solutions to new problems. But most importantly, let's keep innovating where we are. Thank you. Thank you.
Irene, thanks for having me. A pleasure.